Concussion is an injury generally associated with contact sports and is frequently mismanaged by those involved, primarily due to the lack of understanding regarding the condition. Concussion refers to an injury to the brain as a result of a direct or indirect impact transmitted to the brain, usually by a blow to the head. A player does not have to lose consciousness or have memory loss to have suffered a concussion. It is therefore highly desirable that all parties involved in rugby understand the importance of identifying and managing concussion appropriately. This includes coaches, referees, teachers, administrators, players and parents. Dr. Jon Patricios, a sports physician and director of the Morningside Sports Medicine Unit in Johannesburg, and one of the world leaders in the field of sports concussion, tells us more.
The referee and coach are often the first people who come into contact with a head or neck injured player, and decisive action on their part may prevent further serious injury. How does one suspect a concussion? If a player loses consciousness for any period of time, if a player has memory loss, if a player appears confused, if a player does not understand calls or phase plays, if a player complains of headaches, nausea, dizziness, blurred vision, sensitivity to light, excessive tiredness, numbness or tingling. If any of these symptoms are present, remove the player from the field. To identify confusion, ask the following questions. What venue are we at? Which half is it? Who scored last? What team did we play last week? Did we win last week? If they are uncertain about any of the answers, remove the player from the field. Any player suspected of having a concussion should be removed from the game or practice immediately. There should be no debate on this. All players suspected of suffering a concussion should be assessed by a medical doctor as soon as possible after the incident. Any player who loses consciousness, is unsteady on their feet, or you in any way suspect to have suffered a neck injury, are to have their head and neck stabilized according to standard protocol. Players suspected of having suffered a neck injury or whose level of consciousness or condition deteriorates should be taken to hospital immediately. The following are important signs of a serious or deteriorating head injury: headaches that worsen, increasing drowsiness, players who can't recognize people or places, deteriorating consciousness, increasing confusion or irritability, repeated vomiting, seizures or fits, slurred speech, enlargement of one or both pupils of the eyes, unusual behavior change, severe neck pain, weakness or numbness in the limbs. During the first 48 to 72 hours after the incident, do not consume any alcohol, take excessive painkillers, place yourself in an environment with excessive loud noise or bright light, study or work at a computer, or exercise at all until a doctor has cleared you to do so. Every individual case of concussion should be treated on its own merit, using as many objective criteria as possible to determine when the player should return to exercise. No time frame for rest from rugby or activity is particularly stipulated, although a minimum period may be recommended. The use of computerized neuropsychological testing, although not essential, is a desirable tool that adds much to the assessment of the cognitive state of the concussed athlete, particularly when the scores after the injury can be compared to baseline test results of the same player. Where resources allow, rugby teams are encouraged to make use of pre-season computerized neuropsychological screening tests. Best clinical practice dictates that medical doctors should include a neuropsychologist as part of the consulting multidisciplinary team making return-to-play decisions, particularly when computerized screening tests reveal significant, persistent, or recurrent discrepancies in psychomotor function. Where no neuropsychological testing is available, it is recommended that a player having suffered a concussive episode be removed from any contact or collision sport for at least 3 weeks. And they should also be symptom-free before returning to any exercise. Returning a player back into the fray too early can have dire consequences. These may include prolonged neurological symptoms such as headaches, disturbed concentration, decrease in class performance, and even death.
Following concussion, a player should only begin the return to play process once the player is without any symptoms. The player has a normal neurological examination, and where computerized neuropsychological tests are available, the results have returned to normal levels. The player should then be put through a stepwise rugby reconditioning program, gradually increasing in duration and intensity. See the BokSmart Return to Play program guidelines following concussion on www.boksmart.com for more information. Players who are symptomatic at any stage of this progression during or in the 24 hours of each stage should return to the previous stage. Particular caution and a more conservative approach should be given to players younger than 13. Players who have suffered 3 or more concussions before, players with learning disabilities, players with psychological disorders such as depression and sleeping disorders, and players with an associated neurological history such as migraines and epilepsy.